So to promote normality and relaxation. So you know, even if you had a backache under normal circumstances, you feel brilliant after having a bath or a shower. So it's exactly the same when you're in labour. So use your bath, use your shower around 37 degrees, so normal temperature. And otherwise you can use like a hot pack or a cold pack. So if you're using it as a hot pack, you can just pop this in the microwave or heat it up with hot water. That's another way of doing it. And then just to wrap it in a pillowcase and then just to place it on your back. And if you're using it as a cold pack, you could have it in the freezer or in the fridge at home and then just take it out. Again, just wrap it up how you don't burn yourself and get freeze burn, and then just place it on wherever you have the pain, and it works really, really well, okay? Otherwise, you could just use a face cloth, and that's great in labour. Sometimes just to make it really cold, you can just dab your face with it, or you can actually heat it up under the tap and again, just place that on your back. And this is a ball which also promotes normality. Okay, and it's again, all you're doing, you can do the figure of 8 in it, or you can move whatever way that you want. The idea behind it is that you're keeping your hips moving all the time. So again, I'm opening up my pelvis, I'm sitting upright, so I'm allowing that baby down into the pelvis. So Mary, this is a really good position, we'll say, for backache. So you can use the ball, leaning over it whatever way you're comfortable, okay? And then your head is the heaviest part, and it's where we carry most tension. Okay, so if you get your head right for labour, the rest of it kind of falls into place, okay? So wherever you can get your head down, on a bed, on a pillow, on a bed table, or on the ball, it just works great, okay? So if you have a good partner at home, they can actually do a few things. Sorry there now. You can do a few things. You can actually put your hands on their shoulders, all right? And with your thumbs, just gently massage all the way out. So it takes that tension all the way away from your shoulders. So gently and across the shoulders and flick away the tension, yeah? And you can come all the way down the back as well. And when you're the person on the floor, mind your back, okay? So for your husband or your partner or your mother or whoever it is that's going to be with you, just to make sure that they are actually down on one knee and they're minding their back. Is that okay? Then they can place their hands here on the shoulders and just come all the way down here. Okay, and you do that as strong or as soft as you need. And you can do this before labour even starts. So the more practice you get in, the better. Okay? And again, this is for when the baby's head is down. A lot of women, though, are coming in what we call an OP position. And I'll show you that now in a second. But they really have bad pain, and it's usually around here. Okay, you remember it? Yeah? So what you do for that, if you're the helper, if you put your hand on their hip and you stabilise it, if you put your other hand, whatever your dominant hand is, the hand that you write with, okay, if you put your hand, and she'll tell you exactly where that pain is. So put your hand there and then just in a clockwise motion, just apply a little bit of pressure. It's fantastic to relieve that pressure when you're actually in labour, all right? And the idea behind this position, again, you're opening up the pelvis, you're promoting gravity, but now you could be in the shower with this and you're getting your back rubbed as well. It's a win-win situation. Is that okay? Yeah. The only other way that you could, or something else that you could do in this position, is add on the TENS machine. And the TENS machines is like an electrical impulse that you can pop on and you control it. So I just happen to have one here. Now there's different makes out there, okay? And everyone is a little bit different. So it usually comes with an instruction pack. So you just use it accordingly, okay? But the pads are the same regardless. Now this just happens to be a light blue and a dark blue, okay? But they might be red and purple or red and black or whatever. So it doesn't really matter. So the idea would be that you actually just place the pads below the bra line, on the skin obviously, all right? Below the bra line on one side. And then it's supposed to be like an X for this one, but they're not all the same. And lobe down on this side. So this is your spine coming along here. And basically you're just placing them on the opposite sides, one on the opposite side of the spine. Okay? So this is the other dark blues. Okay? Is that okay? So when you're ready and they're turned on, then you can turn, or they're placed, you can now turn on your machine. Now I'm not going to turn it on because I don't want to give her a shock, is that okay? But these are the buttons here, so you up it or down it. So you're the one that controls it. So you know what pain relief you have or what pain you have. So you might want 20, 30, 40. It goes up to 100 and you control it. And then at some stage it might be too much and then you just bring it back down again. Is that okay? Then you can attach it onto your gown or your top and then you can bring it wherever you're walking and mobilising, okay? If you need to go into the shower, then you just take it off, turn off your machine, because that impulse is still going through, okay? So it's really important to turn it off first, otherwise you end up with a lovely hairstyle because all the electricity will have gone through and you don't want that, okay? So turn off your machine and then just take back off your pads. So it'll be on your skin, they peel on and they peel off. Sorry, I'm sticking it to your top. And you can just replace them again. So then when you're finished in the shower and you want to put back on your TENS machine, then you can use it again. Yeah? Is that okay? Fantastic for if you're at home and you've got bad pains in your back and you need to come into the hospital. It works really, really well, okay? Just if you have them at home, just to take out the battery, that's all right? But bring them in with you. You can use them up until the labour or the baby's actually delivered. They're fantastic. Okay, knowing that it's normal to have pains is really important. And sometimes we can play tricks with ourselves in that if you imagine the pain being the worst pain that you can possibly think of, sometimes labour pain never reaches that pain relief or that maximum. Does that make sense? So you're just playing tricks with yourself, that's all it is. So the more you can go on in labour without any kind of intervention or any kind of pain relief, the better. Having said that, if you need pain relief, it's there for you. So the first ones, like we talked about, is your bath, your shower, your mobilising, your squatting, all right? Then the next bits then that we'll move on would be your TENS machine if you need that. And then the next alternative, this just is Entinox. So it's piped in and it's perfectly safe to use in pregnancy. This is a face mask and then this is a mouthpiece. So you choose whichever one that you want, all right? And what it is, it's 50% oxygen and 50% nitrous oxide, okay? So you shouldn't really be taking it before 3 centimetres. And the reason for that is because we only say you're in established labour at 3 centimetres. So your head goes a bit dizzy and you sometimes get a bit sick on it. So after 3 centimetres, the best way to do is to use it when you have the pain. So when you feel that contraction beginning to build up, right? So you know they'll be coming, say 3 to 4 in 10 minutes. That's what we're aiming for. And they initially, at the start of labour, they're short. They're 30 seconds. They're not really bothering you, they're a bit period-like, okay? And then they'll gradually build up to maybe being 40 to 60 seconds. And at that stage then, so hopefully you're about 3 centimetres or 4 centimetres, anything up to 8 centimetres. And then at 8 centimetres, it starts to get a little bit stronger and the nature of the pain starts to change in that now you nearly feel like pushing the baby down rather than before that. Does that make sense? So I have a chart and I'll show you that on the chart in a minute. But just for the Entinox, the easiest way to do is hold the handle, whatever way you're comfortable holding it, okay? We'll turn this mask around. So take a big deep breath in, when that contraction is there. Hold it for a second or two and breathe out. But when you're breathing out, relax down your shoulders as much as you can. Because remember, you want to be like a rag doll and you want these, the muscles to be as soft as possible. So. Okay, so it's to use it when the contraction starts. Keep breathing it until you reach the peak of that contraction. So when it's the absolute, the highest that it's going to be, and you know the contraction is beginning to come off down the other side, then take your gas and air away. So I suppose for pain relief, you start small. So you start with the normal things. You start with your bath, your shower, your hot pack, your eating, your drinking, your mobilising, keeping moving. And then if you need the next thing, you'll be moving up to gas and air. And then there's another thing called pethidine. So it's actually a sedative rather than an analgesia, all right? Which means that it makes you a little bit sleepy for some people and it affects people differently. So what we wouldn't want you to do after a pethidine injection is to be walking around the place. So where you're sitting just there is perfect. So the idea behind the pethidine, where it's really, really brilliant, is say if I'm getting intense pains, but yet my cervix is not opening, okay, and I just need to relax. Even though I think I'm relaxed in myself, the pethidine actually relaxes down the muscles and it just makes you a little bit more relaxed than you are, and it hopefully, the idea behind it is that it helps open up the cervix.